You unlock the door to a seasonal cabin or a backyard shed that hasn't been opened in months. The air inside is stale. Over in the corner, you spot a small scattering of mouse droppings. Your first instinct is usually to grab a broom or plug in a shop vacuum to clear the floor. In this specific environment, that is the most dangerous choice you can make. Sweeping kicks up a dense cloud of microscopic dust. If those droppings belong to a rodent carrying hantavirus, you are now surrounded by aerosolized viral particles originating directly from their dried urine and feces. The rodents that carry this pathogen show zero signs of illness, but for a human who inhales that contaminated dust, the mortality rate can approach 40%, depending on the specific viral strain. Catching the infection early is incredibly difficult because of a clinical blind spot. The initial symptoms, fatigue, fever, and heavy muscle aches in the thighs and back, perfectly mimic the seasonal flu, which often delays patients from seeking urgent medical care. The danger of hantavirus is its ability to hide an incredibly lethal infection inside the dust of routine household chores. This viral family does not attack everyone in the same way. The pathogen operates differently, based entirely on geography, splitting into two distinct clinical syndromes. This map illustrates the geographical divide, splitting the world into two primary viral territories, the Americas and Europe and Asia. Focusing on the Americas, strains like the Sin nombre virus carried by the deer mouse trigger hantavirus pulmonary syndrome, or HPS. When inhaled, the virus attacks lung capillaries. Blood vessels leak, rapidly flooding air sacs with fluid, effectively drowning patients. Panning to Europe and Asia, the threat changes. Here, strains carried by rats and voles trigger hemorrhagic fever with renal syndrome, or HFRS. Instead of the lungs, HFRS targets the kidneys. It leads to sudden internal bleeding, severe drops in blood pressure, and acute kidney failure. Regardless of which hemisphere you are in, hantavirus weaponizes the human vascular system to trigger catastrophic organ failure. There is one terrifying exception within the hantavirus family, found primarily in South America, the Andes virus. It is the only strain known to cross the barrier into human-to-human transmission. The spread is highly localized, usually striking close family members or the healthcare workers treating the initial patient. Diagnosing any of these strains early on is difficult. If you test a patient within the first 72 hours of infection, the result often comes back as a false negative, right as the virus is rapidly multiplying in their system. As you can see from this image of a scientist working in a heavy biohazard suit, studying this pathogen requires extreme containment. Because of these difficulties, doctors currently have no specific antiviral drugs capable of stopping the active virus. Treatment relies entirely on intensive mechanical life support. For HPS, that means intubating the patient to force oxygen into their lungs, while HFRS requires dialysis to manually clean toxins from the blood. Medical teams must keep the patient alive long enough for their own immune system to win the fight. Modern medicine has no cure for an active infection. Doctors can only buy time, making physical prevention a literal matter of life and death. Breaking the chain of infection permanently would require a universal vaccine, which remains the ultimate goal for researchers. Developing one has been blocked by massive scientific hurdles. There is extreme viral diversity across the different global strains, and researchers lack accurate small animal models that replicate the human disease. Progress is happening. Scientists are currently exploring modern mRNA and DNA platforms, and South Korea already uses a localized inactivated vaccine called Hantavirus to protect against local strains. Until a globally approved vaccine exists, physical prevention and safe cleaning protocols remain our only proven defenses against exposure. The CDC and Mayo Clinic outline a strict first step when dealing with rodent droppings: leave the broom and the vacuum alone. Before entering the enclosed space, you must air it out thoroughly. When you do go in, wear a respirator mask and rubber gloves. Next, heavily soak the droppings and any nesting materials with a bleach or household disinfectant solution. Let the liquid sit for a full 5 minutes to completely deactivate the virus, then wipe it up with disposable paper towels. Hantavirus is one of nature's most efficient killers, exploiting our instinct to tidy up. By replacing panic and brooms with patience and bleach, you can neutralize the threat entirely. You unlock the door to a seasonal cabin or a backyard shed that hasn't been opened in months. The air inside is stale. Over in the corner, you spot a small scattering of mouse droppings. Your first instinct is usually